Meetup. Yes, that's important that we record the meeting. Thank you. So this is our second meetup of the year. It's actually the first virtual meetup that we are hosting. So really excited that we've got a good turnout tonight. We have an amazing itinerary that I'll get into in a second. But before I do that, I want to introduce who this group is and why we're here. So Jen, if we can go to the next slide. So this is really, we call ourselves a support group, really. And this came together as three different organizations, grassroots organizations from the Southern Ontario area came together and realized that we need a community for people with monocular vision or individuals that have lost their eyes or have single-eyed vision or have experienced some kind of eye trauma because traditionally there wasn't really a group for people with these unique situations. So Struyowski Prosthetic Eyes is an organization that Andra started. She's an ocularist, and she'll talk about everything that she does. But she's definitely one of the founding members here, along with Genevieve, who is works with the Canadian Retinoblastoma Society, or RBS for short. Which is a group that was created to support individuals that have retinoblastoma. And they have done amazing work here and have been organizing a lot of great community events. And of course, One Eye Collective is an organization, a nonprofit that I started 2 years ago because I too found that I didn't really have a group or a community to talk about the things that I needed to talk about as someone who experienced eye loss midway through my life. And so we came together and realized that we want to create a space for everyone to be able to join and share their stories, build a community, learn, and just look forward to because it's really awesome and therapeutic to have a group like this that you can connect with. Everyone deserves to have a sense of community. So we are so we've been able to organize these events, and we hope that they continue to grow. And we're so excited that this is the first virtual one and that you guys can all join us. So that's a little bit about how we all came together. I don't want to take up too much time. We'll definitely have some time at the end if there are questions. Because we did start a little bit late, we are willing to stay on a little bit longer just in case there's any questions or any conversations that we want to extend beyond the hour that we have this event scheduled for. So with that, we'll go to the next slide. Are you guys still seeing the presentation? No? Okay. Let's see if we can get that up. Jen, are you with us?
Yes, I'm here.
Oh, Jennifer.
Oh,
Nice that you can join us. I was looking for Genevieve, though. I think we may have lost a really cool agenda for this evening. We are going to start off with a very special guest that's joining us, Dr. Neeti Kochar, who is going to be talking to us about eye loss and monocular vision and monocular health. So, really pumped to have her with us and share her time. We know she's a really busy doctor. I sometimes see her on the news. So, excited to get into her presentation momentarily. Followed by Dr. Neeti's presentation. We will have a special segment by Andra, who is going to do an Ask an Ocularist series. So she'll talk all about artificial eyes and answer any questions you guys have because there generally are a lot of questions about artificial eyes. And then lastly, we have a special workshop for you guys, and that is all about crafting and framing your eye story, which is going to be led by Genevieve. So lots of things to get to in the agenda today. Once the presentations have concluded, we could definitely do a roundtable. We want to give an opportunity for folks on the call to either introduce themselves or share their stories or ask any questions that they may have. So we will get to that. So without further ado, let's get into the presentation. So Neeti?
Thanks, Nat, for the introduction. Good evening, everyone. It's so nice to be here. I'm super excited to be having this conversation about eye loss and monocular vision. And I'm also looking forward to hearing about everybody else's journey as well at the end when we open up the Q&A. So for my presentation today, I would like to start off talking a little bit about what monocular vision is and how it actually impacts us. I first want to talk about just in very simplified terms, like the optics behind it. And I'm sure, many of us here might already have a good idea about it. But with monocular vision, there's really three areas that we like to, kind of hone in on. And the first one would be depth perception. And basically, depth perception is our ability to appreciate 3D vision. And essentially, both eyes are required to see 3D. You basically have one image that comes in from the left eye and then one that comes in from the right. And then it's the brain's responsibility to kind of fuse these images together and create an image that we can appreciate to be 3D. Now, obviously, with monocular vision, 3D vision is not achievable since we don't have both eyes working together. And so oftentimes this can lead to difficulties in being able to judge the distance between two objects or kind of getting an idea of how much space might be between two objects. Um, Oftentimes, this can lead to trouble with hand-eye coordination, and it makes it a little bit harder to kind of look at refined details and appreciating things like texture. The second thing that monocular vision does impact is our field of vision. So when both eyes are functioning, we are able to see a lot further out in our horizontal field, both in the left and the right side. So when we only have one functioning eye, understandably so, our visual field won't be as vast, and that can start to be an issue when it comes to blind spots, because basically what happens is each of our eyes, they just by design, each eye has a blind spot. And what happens is the other eye usually compensates for that with that eye's visual field. So blind spots can become a bit of an issue with a reduced field of vision. And thirdly, visual acuity, which is basically the accuracy and the clarity of what we're seeing out in front of us. Now, the good thing is that patients with monocular vision, oftentimes their good seeing eye can usually see 20/20 or even better, which is obviously great news. But things like contrast sensitivity, like so for instance, being able to appreciate how bold letters may be on a background, it does tend to be a little bit more optimized when we have both eyes working together. So that's kind of how monocular vision, works in terms of the optics of the eye. And so what I want to get into next is how monocular vision actually affects our everyday life. And I've categorized it into two categories, really. I think there's a physical component to this, and a social aspect to it as well. And so, when you have one eye pretty much running the show, that eye can tend to, pick up a lot of strain and fatigue over time. That eye can also become more sensitive to light and glare over time as well. And then because of that lack of, extended field of vision, oftentimes we have to move our head a little bit in much more prominent ways, which can over time cause overuse of the neck muscles, leading to chronic neck pain as well. From a social perspective, kind of going back to my previous slide about hand-eye coordination, because we lose that ability to appreciate depth, it can be hard, in terms of shaking hands or grasping objects or even writing things on paper. Maintaining eye contact can be a little bit tougher as well. Overall, from a lifestyle standpoint, it does often require us to modify what kind of activities and sports we're partaking in, keeping in mind that the safety of our eye is the main concern. And oftentimes that can cause, loss of hobbies and certain work opportunities that may be of interest to us. So I would say that those are where the physical and social challenges may be with managing monocular vision. Um, the good thing is, just heading over to my next slide, Managing monocular vision has become, you can still lead a very high quality of life when you know how to manage this quite well. And thankfully, there's lots of ways to do this, and there's always new technology and new research coming out. And so what I'll get into next is just some of the do's and don'ts that we can look into just to make this a little bit easier for us. So getting into the do's, the don'ts, and everything in between. We'll start with the do's first. So, something that I think is pretty second nature to us is to obviously use protective eyewear when in our daily, everyday life, and as well as when it comes to our jobs and occupations. A term that we may have heard of quite a bit is polycarbonate, which is basically a lens material that is quite resistant to impact and not necessarily shatterproof, but it does take, quite a bit of force for that type of material to shatter. So that is a very important lens material to consider when getting a pair of glasses or even safety eyewear. And even for those who don't necessarily need any visual correction, because, when it comes to their acuity, they see quite well, I would still recommend to go for a pair of prescription glasses. They're just plain and prescription, but they still have the polycarbonate material, as well as the all the coatings with the anti-glare and the UV protection, blue block. That is something I still recommend. Now, another thing to keep in mind, which sometimes people might overlook, is as important as it is to have the proper lens material, it's equally as important to consider a very high quality frame. Because, I mean, if your frames are still prone to breakage off of a little bit of impact, then, it's really defeating the purpose of even having strong lenses. So materials like titanium or materials that have like a metal memory, if you'd say Flexon is one of the brands that do that. Those types of materials are a little more higher quality and less prone to breakage. Protective eyewear for sports and leisure, wearing safety goggles while partaking in certain sports, and then, the ones like, for example, where you have a ball or a base or a bat, things like that, that may actually cause actual blood trauma to the eye. Those are some of the obvious sports we might consider, but even sports like swimming, like we may not think that's necessarily dangerous from a high impact perspective, but even just having chlorinated water in contact with our eyes, that's something that is not the safest. So even making sure you have a good quality pair of goggles for even water related activities is very, very important. Another device which people may not know as much about is something called an eye cup block. So for example, for those who like to do photography, or if you work in a lab and you're working in using a microscope, eye cup blocks are these little devices usually made from some type of plastic, and they really serve two purposes. So first of all, the eye cup block can help to stabilize your eye and your whole face for that matter. And second of all, the walls of the cup will help block out like wind and air and debris, especially if you're working in an environment which, may not be the safest for the eye. Protective sunglasses, that's something I think most of us are already aware of. Protecting your eyes from UV exposure as much as possible is super, super important. Also important to keep the eyes lubricated. Now, many of us do have a certain level of dry eye, and oftentimes we're not aware of it, especially if it's a mild form. The issue with dry eye is if it does tend to go unattended, it can at some point lead to pretty severely reduced vision just because of the quality of our tear film, um, you know, kind of disintegrating over time. So ways to really just maintain a healthy tear layer and keep the eyes moisturized is to have some high quality preservative artificial tears handy. And, for those who have a prosthetic eye, to also have drops that are compatible for that. And even things like a humidifier, keeping that at home, especially in the drier winter months, really going to help add some moisture to the air. That's a great way of preventing your eyes from becoming too dry over time. Uh, Something a little bit less known that I think still has merit is to consider vision therapy. Now, there is potential here to rewire our brains with VT or vision therapy. Now, depending on when the monocularity took place, so for instance, if it happened from at a young age versus if it happened later on in life, if it was acquired due to a viral issue or trauma or injury, depending on when you start implementing vision therapy, there can be times often where we can learn to almost develop a type of depth perception, not necessarily literally because we don't have the two eyes functioning together, but just in terms of how we rewire our brain. And there is, like I said, it's not going to necessarily work all the time, but it is something worth considering there as well. Um, and basically, the last two in terms of always taking precautions and listening to your intuition, I think those are, something that kind of comes naturally to us. Navigating crowded areas, watching out when you're taking staircases just because of that depth perception issue again, being cautious when driving, or even being mindful of where you're sitting or standing, because that's where blind spots can become an issue. And then, just that last little bullet point there, really honing in on your heightened senses. Everyone will have differing levels of comfort. You may even know someone who's dealing with monocular vision as well, but what they may feel comfortable partaking in may not work for you, and that's totally fine. So I would just say it's really important to, listen to your gut and see what feels most safe for you, and really when it comes to any decision making process, you really just want to ask yourself if what I'm about to do in the interest of safeguarding that functional eye. Um, so that's where I would say is like the most important things to keep in mind. Finally, when it comes to things to avoid, this kind of is an overlap for the things that we just talked about. Obviously, we talked about this. Try not to engage in high risk sports and activities that could cause trauma to your functional eye. And of course, if you do need to take part, like we said, don't do that without any high quality protective eyewear. Don't neglect the health of your eye. And, this could be simply as, making sure that you're attending all your eye appointments. And, we often have many kinds of eye care professionals that are involved. Your optometrist, your ocularist, your vision therapist, occupational therapist, even situations like skipping medications and lubrication when it's required. Those are all ways in which, you can protect the health of your eye and just, maintain overall. Now, just because we have, reduced vision, it doesn't necessarily mean that we don't have any visual cues. So for example, when you're driving, using those landmarks, those road markings, or, following a routine pattern that you're used to, those are all visual cues that you definitely want to hone in on. And obviously we get visual cues from other senses as well. So really paying attention to those. Another one that's really important is to take frequent breaks from your periods of close work. So, we're all behind screens these days, computer, laptop, tablets, even reading a book, or if we have any things that we like to do up close, like sewing, knitting, any kind of thing, any kind of task that would be around 40 to 50 centimeters away from you. That leads to a lot of muscle exertion, and that can cause fatigue over time. So I always just tell my patients, every 20 to 30 minutes, you want to take a break from your close work, and then even just looking out into the distance for about a minute or two, or, getting up, going for a walk, coming back to your work after a few minutes. That's really going to just help relax your visual system. And, lastly, I would say, yeah, don't be afraid to ask for assistance when you need it. And this can come in all forms. Obviously, from a professional standpoint, seeking out the, help when you need it from your professionals around you. And even when it just comes to being out in public, if you're at a store and you need help navigating for whatever reason, I think patrons are more than willing to help you out. And I would say that those would be the main things that I would really look out for. And that's pretty much it. And I look forward to answering any questions you may have at the end of our presentation.
All right. Awesome, Niti. Thank you so much. I learned quite a bit. I especially like what you said about um, different people finding different levels of comfort and like going with their gut, because that's something I notice a lot. And as long as people know, you can hear what other people do, and that can be inspiring, but it might not also be right for you. And so I think that's a really good piece of you know advice for people.
Yeah, absolutely.
Okay. So my section's called Ask an Ocularist, not because I'm just gonna like wait for you to ask me questions necessarily, though you're welcome to ask me questions at the end. But I also want to talk about how you can talk to your oculist, how you can ask your ocularist for what you need so that you can make sure that you're getting the most out of your relationship with your ocularist. Because really the ocularist and the client should function as a team, right? We've got the same goal. And the feedback that you can give your ocularist is valuable. Just stay on the first slide for now, actually, if you don't mind. I'll get there. All right. Um, yeah. So I'm just going to talk a little bit about what you're entitled to as a patient and what you can expect from an ocularist. Some of this stuff is specific to Ontario, so I'm not sure if anyone's tuning in from outside of Ontario, but usually from region to region, this will hold fairly true. Now, the first thing, which I think is really important that everyone take advantage of, is that in Ontario, you're entitled to a 3-month warranty for every new eye you make. And that means that if anything comes up in that first 3-month period, you should talk to your ocularist because sometimes you walk out of the clinic and you're thrilled with the eye, but your muscles and your tissues adapt and maybe it sort of sinks into a new position and it doesn't look right, or you see it in the light in your home, it doesn't look right anymore. And you should really take advantage of this warranty because nobody wants you wearing an eye that you're not happy with when there's something we can do to make it better. Um, that said, there are times when your ocularist will let you know that there might be trade offs or drawbacks to the changes you want to make. So let's say you want the upper lid to come up a little more. So to add a little more material, that might make the lower lid droop or something like that. Maybe the color is so close that if you make it lighter, it will be too light. So the important thing is that at the very least, your ocularist should be willing to explain your options to you, to let you know what is or isn't achievable so that you can know whether you want to take the risk of making that change or not. But you shouldn't be shut out from the conversation. You should really have an open opportunity to speak to your ocularist about these things. And as I say, like that's what we want. We really want our best work. We're all very vain about our work and we want it to look great. So give us that chance. The next thing is adjustment. So after this 3-month period, if you find that your eye isn't fitting you as well as it was initially, you're also entitled to adjustments. There will be an additional cost for this, but the government will chip in as long as it's based on changes that have happened in your body. So after the first 3 months, if you just decide you don't like the color, that wouldn't be covered. But let's say you your body has changed, you've had surgery, or your weight has fluctuated, or you're just getting older, or you're a young person and you're growing quickly. Anything that has changed in your body that has made the eye not fit anymore means that you should definitely get it adjusted, and there should be support for that from the government funding and from the insurance funding. So that's important too, because if your eye's not fitting you properly, you really should ask your ocularist for an update so that we can improve it for you. Now, the next thing is the regular maintenance of the eye. So, what's recommended and is pretty uniform throughout from place to place is that you come back to your ocularist about every 6 months so that we can polish it to a high optical contact lens finish. So that's a very smooth, shiny surface that's as smooth as a contact lens. And we can do that in our equipment. In addition to this, most ocularists, including myself, recommend that you remove it about once a month and wipe it with a wet paper towel. It sounds a little bit crude and simple, but it's actually been shown in studies to do the best job of reducing the buildup on the surface. So these recommendations are built out of the fact that minerals and proteins adhere to the surface of the prosthesis over time, and they cause this buildup. And the amount of buildup varies quite a bit from person to person. But on average, we find that this routine of 6 months between professional reglazing and 1 month between home cleaning is about right for most people. Now, one thing we don't generally recommend is that you take it out every day and wash it, unless there's extenuating circumstances. But um, generally speaking, we'd like you to leave it in a bit more as long as you can tolerate it. And the reason for this, okay, I'm ready for the next slide now, is that is that a certain amount of buildup of these proteins and minerals on the surface of the eye can actually, quite surprisingly, be beneficial. And this is a really interesting area of ophthalmological study that extends beyond prosthetics, but we're learning a lot about the microbiome of the eye. And one of the ways this impacts prosthetic eye wearers is that when we get this protein and mineral buildup, especially when it's on the back of the prosthesis or the outer edges, it could actually help the tears adhere to the prosthesis and increase the wettability of the eye. So some of you might have noticed when you leave your eye in, it starts to actually feel better after a while. It starts to feel wetter. Now, the reason why we don't just leave it in forever, and we do recommend you wash it off periodically, is because when this protein and mineral buildup starts to encroach on the front part of the eye, it can start to irritate the lids because the lids in that area are moving quite a bit. So the areas that are in constant contact with the tissues, the buildup is good, but once it starts to encroach on the front, it starts to cause irritation. And so what I have on the screen here is some images from a study done in 2013 by Keith Pine. And if you'd like to read the study, the QR code will take you to that. But you can see that he's taken these prostheses out, and he didn't just look at one, he looked at a number of them, but there's images from one of the eyes. And he's stained the eye so you can see where the deposits are sticking. And for the first 30 days or so, the deposits, the colored area indicated by the stain, are mostly in the back and on the sides because the lids are like windshield wipers, wiping that front surface. But as time goes on, it starts to encroach upon that front area. Now, it's obviously not a alarm clock at 33 days, it's in the uncomfortable area, but in general, the 1 month mark tends to work for most people. So if you've ever wondered why you've heard that recommendation, there actually is some clinical evidence to support it there. Okay. So that's why we want to see you every 2 months, and that's why we tell you to take it out. Let's see. I think I'm ready for my next slide now. So the next thing I want to talk to you about is going to be sort of maybe a launching pad for some of our discussion later. And it's to ask this question, why do we wear a prosthetic eye? You're probably thinking, well, because I lost my eye or because I was born without a fully developed eye or something. But I think there's value in asking this question because there's actually a number of different ways that we can answer it. So on the one hand, you might think, well, I wear it to hide something or disguise something that I don't want someone else to see. But that's just one part of it, I think. I think that's maybe not even the main part of it for some people. I think in a more positive way of looking at it that I've heard from a lot of people is that it actually has this active social function. Some things that Niti mentioned as well is the social function of our eyes in terms of having eye contact, indicating our attention to something, right? Making it easier to converse with someone else, making your eye loss not the focus of your conversation. So we wear these natural looking eyes sometimes to either take that off the table and be like, this isn't all of who I am, or even just to simplify the way we're connecting with someone. So that's why even someone who, doesn't have any vision, who's completely blind, might wear prostheses because they might feel more grounded, right? I'm ready for the next slide, actually. Thank you. um, to reciprocate eye contact, to feel like you're healed when you look in the mirror after is also another one that I hear from people a lot. When they first get their first prosthesis after an accident, it can be quite impactful to see a face that they recognize. Okay, I'm ready for the next slide now. But as much as the prosthesis can help someone, feel like themselves again, or not have the eye loss be the central focus, more and more I'm meeting people who are finding ways to sort of acknowledge the reality of their eye loss in a positive way. Um, and it doesn't always involve wearing a natural looking eye. It can, but there's alternatives that I'm very excited to see people exploring. So I've included some images here of Fatty Wap, who notorious or well known to have worn. He doesn't wear any prosthesis. He's very comfortable, as a celebrity, um, just accepting that's how he's proud to look. There's also people who wear eye patches, which can be really, amazing expression of how they feel about their relationship to their eye loss. And sometimes it's something that they're also feeling pretty confident about. And then there's also people who choose to wear an eye that doesn't match their eye. So I have permission from one of my patients who unfortunately couldn't make it tonight, but he welcomed me to talk about his experience with wearing an artistic eye or fun eye. And this was the first eye he got after his surgery. I made him both a natural one and an eagle eye. So it's an eagle in flight. And he told me it was because he wanted to have a bird's eye view of things. And when I made this eye for him, and he was just thrilled, and he was like, "This one feels more comfortable than the natural one." Like he just really felt at home with the eagle eye. And I followed up with him a few weeks later, and I was like, "How's the eye?" And he was like, "It's great. It's a perfect match." He was talking about the eagle eye. And I was like, that's just so beautiful. And I really enjoyed working on that with him, because it was such a great way where he could express himself and his sense of, who he was, and his like he has an eagle in flight. Like what better symbol of liberty, right? Um, so that's a really great experience for me as an ocularist. That's something that when I get the opportunity to make a non-matching eye, I think of it as a great honor. And I love, talking about them with other people and talking about their experience. So I'm hoping that as the conversation continues tonight, if anyone wants to share their story about their relationship to wearing a non-natural looking eye, we could talk about that. Um, Before we go, I just would mention, or before I finish up, I just want to mention that generally speaking, most ocularists won't make artistic eye and charge insurance for it, whether that's like public insurance or private insurance. But a lot of us, once we've done the fitting and we have the mold, um, we will we're willing to give you one for a fairly reasonable rate, let's say, because we already have done all that work to make the shape. But there's also people, like I've noticed, eye makers on the call, and they have a great service where they let you send in your eye. So if you have an eye that's fitting really well already and you're confident about the fit, that's another option for people that I think is really great. So hopefully we can all talk about that stuff as the night progresses. And I'll send it over to Genevieve now.
Thank you so much. I really appreciate the information that we've discussed so far. Also learning things, and happy to be here discussing forming and shaping your comfort with telling and explaining your eye story. So I have to disclose that I am borrowing my content from Zali, who is on the call tonight. She is someone that I met at a recent conference, and she is a specialist and a counselor and an expert, a researcher in this area. And so I've been watching some of her YouTube content, and one of the topics that she covers is on shaping and building upon your story and the ability to have comfort with telling your story. So I will give the credit to Zali that I have built my presentation this evening based upon her work. So I wanted to start by just looking at kind of the nature of telling your I story and understanding maybe how it can be different depending on the circumstances and the audience that you're talking to. So obviously, I think if we're sitting down with a friend or a colleague or a coworker, maybe a family member, and we actually have the time to explain a situation, our story would look different than if we're asked what happened in passing at a grocery store or at a event where we might want to snip it and put a few sentences together. So that's the form that I'm going to kind of focus on tonight, is kind of writing a short version that you're comfortable to be able to kind of put out there while preserving some of your personal details. So just to keep in context who you're speaking to and who you would be writing this story for. So I have a couple of photos because when I watched Zali's presentation, I found it helpful that she had these diagrams. So when we're starting to think about forming our story, the format that I thought was helpful was to make some jot notes and compile the facts based on information that either you're aware of or that you were told. In my circumstance, I lost my eye as an infant, so many of the things that I know about my eye loss were told to me, versus some of us might have lost their eye as an adult or as a teenager and might have better memories of specifically what occurred at that time. So I know I probably should stop blurring my background. There we go. So you can see my sign. So I'm starting with the beginning, where we're looking kind of as a bubble or a map of the content in terms of the who, what, when, where, and why, that you would maybe put together a sentence or a thought per area and kind of get your thoughts or your ideas started on paper to kind of orient the idea and the topic, covering all of the aspects. But then as we go through, we narrow it down a little bit better. So when we get to the middle, we might add some specifics in this situation. So here, I think that we want to look a little more at what happened, still drawing out facts and the where, why, how, and who was involved in the situation. In this one, around the middle of the content, we might also look a little bit at the outcomes and not just the starting of the story, but also in terms of what happened and what is the outcome of that situation. Once we've formulated a few of those thoughts and we've started to write down or put on paper some of the who, what, when, where, whys of our I story, this is where we would try to look for our takeaway messages. For each person, I feel like that would be different. So I've put together a few things about my own story to help understand a little bit better. But here we have the kind of bubble around the ending, where we would say kind of what do we want them to remember a little bit about who you are and what your strengths might be. And again, focusing on factual information in terms of what happened in your life and how it affected you. So when we put together those kind of beginning, middle, and final, and we've gotten through the how, what, when, where, why, this is where I would maybe compile some of the key ideas that came from that script. So for myself, I wrote down some of the statements like, I now see with one eye, I drive a car, I play sports, I enjoy meeting new people, and that I live with a prosthetic eye. I often get asked if it hurts. So I think that would be something that I would answer. And can it be fixed or repaired? And I find that's something that people ask often as well. So that was some of the things or statements that I thought from my beginning, middle, and end that would really kind of stand out, and some of the takeaways that I would want people to understand or know about my experience with eye loss. I think one of the things that was important when I was listening to Zali's presentation was to avoid minimizing your experiences when you're telling other people your story. I think it's important to be mindful of language, and that sometimes unintentionally we will try to protect others by minimizing our own story. And I think it's important that we own our powerful stories and that we don't try too much to be concerned about impacting someone else's perspective or feelings around what you yourself have been through. And I'm not saying that that's an easy process, but I do think that it's important that we own the story without minimizing. So some of the words that she mentioned, and I think it's important to just be mindful of, is maybe the word just, because I think sometimes it's, just an eye, or it's, just an accident, or whatever it might have been that occurred in your life. It was just cancer for me. So I think it's nice to make sure that we're using powerful language when we're talking about something that's so important to ourselves. And then the other piece that I really took away from the presentation by Zali was around practicing self-care. So remembering that while you're writing this story, it's very intimate and it's very personal and it's very vulnerable. And while you're shaping your comfort level and your ability to articulate what's happened to yourself, it's understandable to feel some things and have emotions, and maybe take your time with formulating the language and feeling comfortable with the script that you've come up with. So Zali does an excellent job at providing a couple of different breathing techniques in her video. And I think that we probably all have learned some of these things over time in terms of deep breathing, taking some time out, enjoying hobbies, making sure that you step away and take a break from this activity if it is feeling really heavy and emotionally draining, and coming back to it when you feel ready and prepared to take this on. And to be kind to yourself, that this is a very sensitive topic and is very near and close to your heart. So it is understandable to need to protect yourself during this process. So I will share with you the script and story that I put together for myself based on kind of the thoughts and the discussions that we had listed in the bubble. I had written down that I was diagnosed with retinoblastoma at 8 months old after my mom noticed a white glow in my holiday photos. I had my left eye removed. I can drive and I play various sports with my one seeing eye. I wear a prosthetic. I do not experience pain, and doctors cannot replace or repair my prosthetic eye. So when I'm speaking to people about my experience, that might be one version that I would articulate to someone when they ask me what happened. And again, I would reiterate that depending on the audience, and because I've had years and years of experience telling this story, the age of the audience often can very much dictate what kind of language I would use or how much content I would share. Sometimes I would take the liberty of answering some of the questions that I know are going to come up next. And other times I let the people ask me the questions and, compose or think and then come up with what they would want to respond with. So I think there are opportunities to have versions of this script, and feel comfortable practicing that language and the different versions for the different audiences that you might be discussing your story with. So I hope that I've given you some tips and suggestions around creating and forming your own story. And as I said, I think it's very important to be mindful that this is a very sensitive and individual situation for each person. So to give yourself some slack and some comfort as you navigate your ability to disclose and articulate for yourself what you're comfortable with.
That was great, Jen. Thank you. A lot of good takeaways there, and so much of what you shared is really resonated with me personally, and I'm sure with others on the call too, especially about not minimizing any parts of your story, which we just subconsciously do sometimes. So really, really grateful for that. Thank you. Um, we're almost at time, but as I mentioned earlier, we can stay on a little bit longer. So we'll turn it over to everyone on the call to see if there's any questions or if anyone just wanted to say hi, maybe introduce yourself, where you're from, maybe share your story. So really leaving it open.